Welcome to the Fit Media Network, the channel dedicated to healthy living and fitness. We speak with coaches, doctors, athletes, and more about their routines to help you feel, look, and perform at your best.
One of the things that I've learned in dealing with my heart and the situations that I've gone through with it is just because you're fit, just because you can do certain things athletically doesn't necessarily mean you're healthy. And so many people find themselves in this same position where they go, hey, I can go out and run a marathon, I'm fine. Or I can go out and ride 100 miles on the bike, I'm fine. And then they overlook symptoms because they think that that's just part of the training.
Yeah.
I know I did that for a long time. I remember being at the velodrome, training after sprint practice and curling up into a ball in knots after an effort. Turns out that yes, while I'm fit, my muscles weren't getting oxygen and I was nodding into a ball. And that was one of my personal experiences with it.
Yeah.
So if I was to say that to you, just because you're fit doesn't necessarily mean you're healthy, what would you say about that?
I would say you're absolutely right. So just by being a human being and living in this world, we are all at risk for high cholesterol, high blood pressure, diabetes. These are things that naturally happen to us, whether it's genetically pre-programmed into us or whether it's environmental factors. We don't eat as well, we don't take care of ourselves as maybe we should. So exercise is great, but it's just another mixture into that pot that then comes out a person. So, and that's true of the cardiology world in general. And these things are all risk factors, right? So blood pressure, cholesterol, diabetes are one side of it, but then you take exercise, and maybe that's a beneficial thing. Maybe that staves off some of these things, but it's not immune therapy. Exercise is not going to cure these things. In certain cases, yes, it could. But just because you can ride 100 miles on the bike or run a marathon does not mean that you don't have high blood pressure, does not mean you don't have high cholesterol, does not mean you don't have a significant family history of coronary artery disease or blockage in the arteries. So the exercise is great, but we should be aware of our risk factors. What is our blood pressure? What is our cholesterol? What is our family history? And then at the same time, really being in tune with our body. So as you said, something was wrong. Like you could go out, you could bike, you could do your sprints. You were getting that done, but then you'd hit the end and you'd curl up in a ball. That was not right for you. There was something off and wrong about that to you. And we can't prevent everything from happening. One of the leading endurance athletes in Australia died, and it raised a whole controversy. Well, did the exercise cause it, or was it something else? And I say, and other people would say, maybe the exercise prevented it from happening earlier. Mm-hmm. Maybe there were symptoms that he ignored. Maybe there were symptoms that other athletes have ignored that they tried to push through and unfortunately suffered consequences as a result of that. So understanding everything, especially as we get older as athletes, and to me the magic number is 35. Before the age of 35 as an athlete, you're probably safe from these cholesterol, these blood pressure things. Not to say it can't happen, but the stats and the data would argue against that. When you cross over that 35 age group, you now become a master's athlete, which is always a hard thing for all of us to accept. Yeah, tell me about it. But number two, I think you really need to start paying attention to these risk factors and understanding what your family history looked like and taking that into consideration. Getting good medical care, if that's something that's a priority to you. Certainly from our standpoint, we would recommend that. And being aware and understanding that just because you do these things, you can run a marathon, does not mean you should ignore that chest pain, does not mean you should ignore that time you passed out when you were running, or that shortness of breath that seems a little bit worse than it did a couple months ago. These are things to pay attention to.
We also, most of us, train using a heart rate monitor or a power meter.
Yeah.
And is there anything that you would see on a heart rate monitor that would give you concern that somebody should be aware of?
So I'm a proponent of those things as long as you understand what the data means and you understand how to use it. If you're just saying, oh, my heart rate's 170, that's great, I hit that, no problem. You have to understand what that data means and know how to interpret it. For someone who's well versed in that information, I would say a slower heart rate recovery would be concerning. So, if you're getting your heart rate up to 160, 170, you stop and your heart rate's still hanging out around the 150s, 160s, and you're feeling symptoms, that might be of a concern to me. If speaking of cycling, if your power zones, your numbers are decreasing within those power zones, that would be concerning as well. But really, again, an individualized basis, having the understanding of what your data means, and then knowing how to interpret it on the other side, and then speaking to somebody who can interpret it as well is important.
Maybe have if you notice some kind of anomaly or something
Correct.
weird.
Yeah, absolutely.
When I had my first atrial fibrillation
Yeah.
episode, and my heart rate hit 240 beats per minute while I was sitting on my couch, I knew something was wrong. And so many times we just play it off to stress or to something else, and it could be something much more dramatic than that.
Correct.
And so I think being really aware of yourself, and we all are. I mean, athletes
for
I
sure.
could tell you what my resting heart rate is, my max is, what my VO2. I could tell you all of these numbers, and probably most of you can as well. So be cognizant of changes or things that are off, and don't just blow it off as to, hey, it's just a one-time thing. If you see something weird, pay attention to it and see if it happens more consistent.
Yeah.
Is one of the things that I'm seeing.
I'd rather reassure somebody, have somebody come into my office and me say everything's okay, you're checking out fine, as opposed to the other side of it where something has happened and now we're talking about how do we get you back, or can we even get you back to where you